University of Wisconsin School of Pharmacy. The talk that we have today is on asthma, and I'm part of the student organization, ROCHI, and we do health talks in the community a few times a month, and you might have seen some of my classmates here last month. So, what is asthma? A lot of people have some misconceptions about what asthma is. So it's a disease of the airways, and sometimes the airways can be swollen or inflamed, and then when they narrow, they can also have muscle spasms. And asthma is worsened by triggers, and we're going to get into those triggers later on. And right now, there's no cure for asthma. All of the medications we have are to kind of control the symptoms and prevent those exacerbations or flare-ups. And the onset is pretty much any age. Anybody can get asthma at any age, and there's not really any rhyme or reason for it. And so we kind of talked about this. What is asthma? So here's a picture of a normal airway. You can see that it's pretty wide and open with a pretty good sized diameter. And then when you're having asthma attack, you have some inflammation and the airway actually gets more narrow, and that's why it's so hard to breathe. You can't get as much air in with every breath you take. And so when asthma is diagnosed, there's some symptoms that the doctor is going to look for. They're going to look for wheezing. They're going to look to see if you have a history of cough, wheezing, difficulty breathing, or even chest tightness. And these symptoms typically worsen with exercise. They can also worsen when you get a viral cold, when you're exposed to allergens or irritants, and those are like those triggering factors that we'll talk about. Symptoms also worsen with weather, especially the cold weather. A lot of people have exacerbations. And then they can also worsen with emotion or stressful times. And some people also have nighttime symptoms. So these are all things that your doctor will consider when diagnosing to see if you have asthma. And it's important, if you feel like you're having these symptoms, to see your doctor. You're going to discuss your past medical history, family history, and there's also questionnaires that kind of assess whether you have asthma and how severe it is, and you would probably take one of those questionnaires. And then there's also a machine that you can use for a breathing test to rule out other conditions. So basically the machine is a tube that you take a deep breath and you blow into it as hard and fast as you can, and it kind of measures the speed and the volume of the air with every breath you take. And so that is going to help with the diagnosis and rule out any other, if aren't diagnosed with it, then possibly look at other conditions. So we talked a little bit about the symptoms. Wheezing is a pretty common symptom. A frequent cough, chest tightness, or shortness of breath. And that makes sense when your airway is narrow. With every breath you take, you're not getting as much air in, so you feel like you have this shortness of breath. So here are some common triggers for asthma. So pollen and mold, that's pretty typical, especially in the spring and the summer. Tobacco smoke, that's potentially a reason that young children might get asthma, is if somebody in the house smokes tobacco. That could be a trigger. Any other kind of smoke, vacuuming, when you're vacuuming, you get all that particles and dust from the carpet that come up. Cold air, huge problem, going to be at this time of year. Exercise, some people have what's called exercise-induced asthma. So when you're exercising, that's when the symptoms come on, but otherwise you're fine, you can breathe normally, you don't have those symptoms. Illness, so if you have asthma, when you're sick, you can have those flare-ups more frequently, so that's why it's important. And we'll talk about this later on too. That's why it's important for people who have asthma to be up to date on their pneumonia vaccinations, flu vaccinations, things like that. Pets, if you're the dander from your cat or your dog can trigger asthma for some people. Emotions, we talked about that. Other allergies, perfumes, scents, dust mites, cockroaches. There's a whole variety of triggers for asthma, and it's going to differ from person to person what their asthma is triggered by. And it's always recommended that if you have asthma, to avoid these triggers as best as possible, just to improve your symptoms and reduce how much asthma flare-ups that you have. So we're going to get into the treatments now. So there's two types of inhalers. There's rescue inhalers, and then there's controller inhalers. And the rescue inhalers are for when you're having current symptoms, to control those. And then the controller inhalers are inhalers that you're going to use every day to prevent those future flare-ups every day. So we'll first talk about the rescue inhalers. The one that most people know about is albuterol. So what it does is it actually opens your airways, because when you're having that attack, your airways are pretty tight and closed. And it's for the immediate relief of the symptoms, so if you're having trouble breathing or having that coughing attack. And it's also used for people who have exercise as a trigger. You use it before exercise, about 15 minutes to 30 minutes before exercise, to prevent those symptoms during exercise and afterwards. And this one is only used as needed. So some medications are used on a schedule every day. This one's only going to be used when you need it and you're having those symptoms. And then for rescue inhalers, if you're ready to use one, these are the kind of steps to use. You're going to shake it up really well, make sure it's all mixed up in the canister. You're going to take a deep breath in and then exhale completely to empty your lungs. And then you're going to make a tight seal with your lips around the mouthpiece. And this is the direction to hold it in. It's going to be upright. You're going to press the cartridge down, and at the same time, you're going to inhale deeply and slowly. And then you want to hold your breath for about 10 seconds or as long as is comfortable. And then you can exhale. And typically these are prescribed to have 2 puffs when you're having that attack, so you want to wait about a minute in between the first and second puff. And I also do want to mention that nowadays these are typically prescribed with what's called a spacer, which is like a small plastic chamber. It's about this long, this much diameter. And what that does is it kind of suspends the medication. You attach it to one end and you put your mouth on the other end. It suspends the medication so that when you're breathing it in, more of it actually gets into your lungs, because the problem with this sometimes is that you get more of it on your tongue, and when you get on your tongue, you actually swallow it, and it gets into your stomach and not into your lungs, which is fine. There's no like serious side effects about that, but you want to get into the lungs to be effective. And so if you ever are prescribed an inhaler, make sure you ask about the spacer. So rescue inhalers, when you first use it, you want to do what's called priming it, and you also want to prime it if it hasn't been used for 2 weeks. So priming means that you're going to shake it up and just spray 3 to 4 sprays away from your face. That's just to make sure that the medication has gotten through the entire device and the mouthpiece, so that when you do put it up to your mouth to take that first inhale, you're getting a full dose and not just like a fraction of the dose. There's also going to be a dose counter on the back of these inhalers. It'll count down, so it'll start at about 200. It'll count down, and that just tells you about how much is left. And then the dose counter actually turns red for a lot of these devices to kind of signal, okay, maybe it's time for a refill, call your pharmacy. You're going to clean it as necessary, so the metal canister cannot be washed, but the plastic part can be washed. You can just separate it, wash the plastic part if you feel like it needs to be cleaned. One side effect with the albuterol inhalers is that it can cause some like jitteriness or shakiness, and that's a very common side effect. And that doesn't last for the entire time. It's maybe about 15 to 30 minutes, you might feel that. And for rescue inhalers, it's always recommended that you carry this with you, because you'll never know when you have an asthma attack, so it's always important to just keep it in your purse or something like that. So everybody who has asthma should have a rescue inhaler, so that's the basics of asthma. And not everybody who has asthma will need a controller inhaler, so that's one difference between the two. So like I said before, a controller inhaler is used on a daily basis to prevent those symptoms, and it's not for immediate relief. So if you're having a current attack, you want to use the rescue inhaler, not the controller inhaler. And a couple of common ingredients would be a corticosteroid. So what that does is, like other steroids, it brings down the inflammation in your airways to open up the airways. And some common products are Flovent and Qvar. And then there's combination inhalers, which contain a corticosteroid and a long-acting bronchodilator, which is a different class of medication, and that's also going to help open up the airways just in a different way. So when you combine it, you can get an even greater effect. So some combination inhalers that are typically prescribed are Advair, Symbicort, and Dulera. You might have heard of these. When you're taking a corticosteroid, because it has a steroid in it and you're breathing it in, it's going to get into your mouth, and it's super important to rinse your mouth with water and spit it out a couple of times after each dose. And that is because when you have that powdered steroid in your mouth, it can cause a fungal infection, which is known as thrush. It kind of looks like white patches in your mouth, but if you rinse and spit after taking the inhaler, it reduces that by quite significantly. So some examples of steroids in controller inhalers. These are all of the actual ingredients, and these are the names of the brand inhalers that have these ingredients. So fluticasone, budesonide, beclomethasone, and mometasone are very common steroids used in inhalers. So with control inhalers, they're actually going to look a little bit different, and they come in different forms. Some of them are going to look like that albuterol rescue inhaler that I showed before, and some of them are going to look like a disc, which I'll show in the next slide. The ones that look like your albuterol rescue inhaler are used like your are going to be used in the same way, but you just have to make sure that you rinse and spit. And then some others contain dry powders instead of that aerosolized spray, and those are going to be Asthma-X and Advair, and then I'll show you what that looks like. So this is the Advair discus. This is the one that has a dry powder inside. So what you're going to do is you're going to slide the cover open, and you're going to hear a click. When you hear that click, that means that the dose has been loaded. And then it'll expose the mouthpiece. Once you've opened it, it's really important not to tip it upside down because that powder is in there that's just going to fall right out and you're going to lose the dose. So what you're going to do is you're going to open it and you're going to hold it like a cheeseburger. You're going to hold it horizontally. And then you've got it open, the dose is loaded, and then you're, just like the rescue inhaler, you're going to breathe out, and then you're going to put your lips up to the mouthpiece and inhale quickly and deeply because you want to get that powder into your lungs. And again, hold your breath for 10 seconds or as long as you can. While you're inhaling this, you might taste the powder because it is a powder. And you might also hear a rattling noise, which is normal for the device. And then you're going to close the mouthpiece and again, rinse and spit. So for the Advair discus or other products similar to that, you're going to wipe and dry the mouthpiece if you need to, but don't submerge it in water or get it wet. You don't need to shake this one because it's a powder. It's not like you have to mix up the aerosolized components inside the canister. And this one is also going to have a dose counter similar to the rescue inhaler. And oftentimes you'll get more than one device at a time, so it's important to only open one device at a time just so that the other products don't expire when you're not using them. And you want to keep it away from moisture, so I would recommend not keeping it in humid places in your house, like your bathroom or things like that, because it is a dry powder. So as you know, like powders, when they're exposed to moisture, they can start to clump up. So that's the reason for that. And these are typically used twice daily, once in the morning, once in the evening. And super important, always rinse and spit afterwards. So we talked about how people with asthma who get sick can have more severe flare-ups when they're sick, and so that's why it's important to get different vaccinations. So for the pneumonia vaccine, everyone over the 65 is eligible for a pneumonia vaccine if they haven't received it yet. It can prevent pneumonia, which can worsen asthma and cause these asthma attacks. And then the flu shot is recommended for everyone. It can prevent the flu, which again would lead to worsening asthma attacks. So I've talked about these flare-ups, and now I'll just kind of describe what they are. So they can build up over a few days to weeks, and worsened symptoms might not be relieved by rescue medication. So like trouble breathing, mucus, and narrowed airways. And if you have asthma, this is something that your doctor will talk to you about, like what symptoms to recognize, when to seek additional help, and things like that. So a lot of times these flare-ups are caused by viruses, allergies. People who don't use their rescue inhalers as prescribed may have more asthma attacks than people who do use their controller inhalers as prescribed. And if you have a pretty bad asthma flare-up, a common thing that doctor will prescribe is prednisone, which is an oral steroid, not an inhaled steroid, and that'll help bring down the inflammation in your airways. But we would like to prevent that. The inhaled steroid is going to affect your lungs, but these oral steroids are going to have whole body effects. That's why we like to treat it early with these inhalers and prevent these attacks so that you don't have to take these oral steroids, because they have side effects that people don't like, and we kind of just want to prevent that. And I talked about this asthma action plan, which is a plan that your doctor would work with you on based on these symptoms, what do you do? And it progresses in severity, so you know when to seek medical attention. So some important points, if you have asthma, it's important to see your doctor regularly. And depending on your symptoms and how they're changing, the medications may change. You may have to step up therapy, which means that you would add on medications or increase the frequency, or if it's improving, you might decrease and step down. It's important to take the controller medication regularly so that you don't have to take that rescue one and you don't have those asthma attacks as frequently. Stay up to date with immunizations, know your triggers and how to avoid them, and then with your doctor develop that asthma action plan so that you know what to do when you have these flare-ups. And so that's what I have today. So if you have any questions, I'm happy to answer them.
I'm approaching 70.
Okay.
Is this age related?
Asthma?
Yeah.
Asthma is not typically age-related. A lot of young kids will get it. You can develop it at any age. That's different from COPD, which is a little bit more age-related, but they're separate diseases. So asthma is not age-related.
So it's not something that I have to worry about right now?
No, unless you're feeling those symptoms, then I would say talk to your doctor about it. But if you're not having symptoms and they're not exacerbated by like the cold or anything other than allergies,
sure.
Yeah.
All right, thanks.
My question is, I noticed there was no mention of like alpha-1 antitrypsin deficiency. It's one of the conditions that are often misdiagnosed as asthma, or one of the symptoms.
Okay.
Misdiagnosed as asthma. And the only reason I bring it up is that my whole family has that condition.
Okay.
And, just to make a short story a little longer, I grew up on a farm, and the triggers are there. I did not know you could breathe through your nose until I was 16, and 17, and went to the college campus. I wasn't on the farm anymore. Before that, I was so plugged up from the nose all the way down. I'd try to work on the farm and I would end up turning blue because I couldn't breathe. And I found out it wasn't the exercise, it was the environment I was in.
Okay, so it was the environment and not the exercise, or a combination of the both?
A combination of genetics and the farm, because exercise wasn't a problem.
Yeah, you worked pretty hard.
Yeah.
Yeah, but when I was on football or wrestling, I had no problems. I was away from the farm. On the farm, no way.
So you had those triggers.
Yeah, the farm triggers, and I found out allergic to cats. And when I go out and milk the cows, the cat would sit on my shoulder the whole time.
That's exactly right.
Know that. Later on, we found out that my whole family has alpha-1 antitrypsin.
Okay.
And one of the symptoms is asthma-like symptoms. Misdiagnosed as asthma.
So was everyone in your family misdiagnosed with asthma, and then you later on found about this deficiency?
Yeah.
Okay.
We've all used the inhalers and so forth. But since I've been, I haven't had a problem for a while, but when I was growing up, I had chicken bone chest because I couldn't breathe, and your bones will actually go like this because of the breathing.
Did the inhalers even help at all then?
That was before inhalers.
Okay.
My younger sisters, who are 8 years younger, did get inhalers, but when I went through, you don't count. It would,
wow.
So it wasn't, it was just kind of my history with
Yeah.
asthma and family history. with
Yeah,
that.
no, thank you for sharing. I didn't even know that, like, that was a deficiency that was misdiagnosed as asthma. That's something that I think prescribers and pharmacists should ask patients when you're thinking about
Yeah.
why is the medication not working, things like that.
Mhm. Yeah,
Definitely.
it should be. My brother was misdiagnosed right up until the time his liver shut down.
Uh-huh.
He ended up with 2 liver transplants because of alpha-1. That's when we found out that we had a genetic issue that exasperates this.
And I wonder if, back then, people weren't really doing genetic screening in patients, but that's like a huge up-and-coming thing right now. What a lot of people are doing is we're finding that medications will actually work better or worse in people that have certain genetic mutations. And so there's a push that for a lot of these medications that we want to genetically test patients to see before we even prescribe it, is this gonna work, is it not gonna work?
Oh, good, I'm glad they're moving in that direction.
Yeah, it's called precision-based medicine. If you hear that term thrown around, that's what it means. It means you look at that person's genes and then tailor the medication based on that.
Terrific.
It's going in a good direction.
What an advancement,
Yeah.
because I've had trouble my whole life because of that.
Now I wonder if it's gonna get better, if that's like a standard of care. Because right now when you go to the doctor, it's not like they're like, oh, let's check your genetics. That's not something that's happening. But hopefully there's gonna be some of that going forward to make sure that we're not wasting time or resources when treating people.
In your studies, did you ever come across like a percentage of the population that is affected by asthma?
I'm sure there's a number out there. I don't know the number off the top of my head. It is pretty common, especially when you're comparing it to other like COPD or something like that, just because anybody at any age can be affected. And then I've also heard that people can like grow out of it, so it can be, so like I know I used to have the sports-induced asthma, and I don't have it anymore, so it's just something that people like grow out of or something like that. Maybe I don't exercise anymore. Then that's why I don't have it.
What do you mean by sports-induced?
So that's that exercise-induced asthma. So for some people, they only have the symptoms when they're exercising, and then they get that coughing and shortness of breath during and after exercise.
Yeah.
And that's when they don't get the controller inhalers, but they'll get the rescue inhaler. And then the rescue inhaler, they only take like 15 minutes before they know that they're gonna go exercise, and then that's all they need.
Right.
And this is all by prescription? Is that how you do this?
Yep, so you have to get it prescribed by your doctor. And even that spacer unit that I talked about, that also has to be prescribed by the doctor, even though it's just like a plastic chamber. There is one over-the-counter product for asthma, but that's only recommended if you are someone who has asthma and you forgot your rescue inhaler and you really need it right now. It's not very effective, but it gives you just enough where you can, make it through and get your inhaler. Yeah. But otherwise, everything's prescription.
Is it covered by your insurance, your health insurance?
Yep, if you have an asthma diagnosis, it's typically covered by insurance.
Well, thank you.
Yeah, very good. Thank you
you.
very much.
Oh, thank you.
Thank you.